My name is Dr. Mark Holmes, and in this short video, I want to talk to you about Sunekos Performa. This is an injectable product that we can use to improve the appearance of the skin in the face, the neck, the décolletage, and the hands. It works to stimulate new collagen and elastin so that when we look at the skin, it appears tighter. We get a reduction in fine lines, and we can even improve the dark circles around the eye. The aesthetics market has been huge for many years, but there's been an increase of up to 51% in the demand for facial injectables since COVID. We are all having patients come into our clinic saying, I've never had any treatments before, but I'm looking at myself in high definition on these video calls, and I suddenly feel that I need to have some help to improve my appearance. There has been a shift from surgical procedures to minimally invasive and non-surgical treatments, and this market is just getting bigger and bigger. I think this is also helped by the social media and the fact that people now know that there are a much wider range of these minimally invasive treatments which they can now have, and the options that they have and the results that they can get. So Sunekos Performa focuses on the extracellular matrix. Now, as the name suggests, this is the part of the dermis which is non-cellular, and it is crucial, but it forms the background in which the cells live, and it nourishes the cells, and in particular the fibroblasts, which produce the collagen and elastin. And it's made of different materials and macromolecules, but certainly collagen and elastin and hyaluronic are what we're going to be focusing on today. With aging, we get disruption of the homeostasis of the ECM. And in particular, we get a reduction in the number of fibroblasts and their activity, which means less collagen and less elastin. There is also a loss of hyaluronic acids, which leads to a decrease in hydration. There are 28 types of collagen now known, and it is the main connective tissue protein of all our tissues and also the skin. It is a very abundant protein, actually making up 25% of the total protein mass and actually 6% of the body weight in humans. Now, although many cells can produce collagen and elastin, it's mainly by the fibroblasts. And we get this pro-collagen sequence of glycine, proline, and hydroxyproline. The collagen is important because it gives resistance and structural support to the connective tissue, and it helps build the scaffold of the extracellular matrix. The elastin gives that stretchability and snapback quality to the skin. Of the different types of collagen, 80% of the collagen in the human dermis is type 1, and that gives it its strength and integrity. Up to 20% is collagen type 3, and that allows that distensibility of the dermis. But this changes with aging, so we get a reduction in the various amounts of collagen. So in neonatal skin, we get 50% of the collagen is type 3, but actually this is down to only 5% in the adult aging skin. So collagen type 1 gives that structure, but collagen type 4 is crucial because it acts as an anchor to the loose tissues underneath. So collagen type 4, and on the diagram on the right, we can see the yellow little blocks of the epithelial cells with below it the basal lamina. You see type 4 collagen, which is anchoring the other fibers and is anchoring the epithelium to the underlying loose connective tissue. The importance of Performa is that very few other things can stimulate this collagen type 4. Elastin gives the stretchability. It is a protein that can stretch within certain limits, and it represents about 2% of the dermis, and it gives skin that elasticity. Tropoelastin is a high molecular weight protein, about 70,000 Daltons, and it has amino acids such as proline, glycine, alanine, valine in a precise amount. Hyaluronic acids vary in their actions depending on its molecular weight. So there are condensation of thousands of disaccharide units of residues of glucuronic acid and N-acetylglucosamine. And it has different properties. So low molecular weight, which we think of up to 2,000 kilodaltons, regulates homeostasis. And it does this because it's hydrophilic, meaning it can attract water and hydrate the skin. But it is also able to stimulate the fibroblasts to produce the collagen, elastin, and blood vessels. It also has an anti-inflammatory action. In contrast, high molecular weight hyaluronic acid, which we think of as 1,000 to 1,500 kilodaltons, acts differently. It's an antioxidant, and it protects the fibroblasts by acting as a free radical scavenger. The diagram on the right shows the various receptors on the surface of the fibroblasts. So the diagram on the top left shows the difference between some young skin and older skin. Now, a couple of things to point out. There is a reduction in the total amount of collagen and elastin, but also crucially in its structure. So the regular array on the left is disorganized, so there is less support on the older skin. So we talked about the different changes and that collagen type 3 and 1 start to vary their ratio, but we also get a decrease of the hyaluronic acids. But just as important, we get an increase in the enzyme hyaluronidase, and that is the enzyme which is breaking down the collagen and elastin. So we get less HAs and they're getting broken down more, so we get even less activity of the fibroblasts to produce the collagen and elastin. So it almost acts as a vicious circle. The two diagrams here show the folding lines discovered by Karl Lange in the 19th century. And he hypothesized that these superficial tension lines were due to the distribution of the various tissues such as bones and muscles. And so that with age, in a specific direction, these tension lines are where the skin lies down in folds and in static wrinkles. The important part is by restoring the healthy homeostasis of the ECM with Sunekos Performa, we can counteract this process. So the platform is the proprietary patent methodology of the HY6AA to restore the constituents of the ECM. Originally, when they were doing their experiments on human skin cells, they started with all the essential amino acids and started taking out different ones to see how that affected the gene expression as measured by relative amounts of collagen and elastin. And in particular, they aim to produce the physiological ratio of collagen and elastin found in the human ECM, because they found that with things like UV lights, they could produce more collagen and elastin, but because it wasn't in that ratio, it broke down quicker through elastosis. So again, we see that diagram. So we have the two components. We have the hyaluronic acid, the low molecular weight, which interacts with the fibroblasts and their receptors to stimulate new collagen and elastin. And the amounts of them and the types of them are crucial because it has the role of opening up different gates on the receptors. And the amino acids are a crucial role as well, because they're helping to promote this collagen and elastin, and with the hydrophobic effect, helping to protect the hyaluronic acid. So the protein expression on the left, and it shows some interesting things. So we have initially the control and the amount of elastin and collagen improved, but with the 6XA platform, we can see that it's dramatic in the Sunekos. On the graph on the right, it shows the UV rays and actually how the UV could stimulate even more collagen elastin, but it didn't last over time. It broke down within 24 hours due to elastosis. And the graphs on the right with Performa showing that we get a deep and a superficial hydration, which is maintained up to 6 months later. So that's important. It's not something that we're getting quickly for a few weeks and then it's all gone. This is maintained for your patients. So how is the role of hyaluronidase in this? Well, we certainly know that hyaluronic acids are hydrophilic, which means they bind water to it. But this mere action induces the enzyme hyaluronidase to start breaking down the hyaluronic acid. So the clever thing about Performa and its exact ratios is that in Performa, the amounts of milligrams per mil of amino acids were increased, so that in Sunekos 200, there was around 33.33 recurring milligrams per mil. This is increased in Performa to 37 milligrams per mil, which means there is more of a hydrophobic effect, which is repelling the water so that the hyaluronidase is decreased in its activity by up to 40%, which means that the hyaluronic acids can stimulate more collagen and elastin, which means better results. The graph on the right is showing that the decrease compared to Sunekos Performa compared to normal HAs, and there's that 40% decrease in action of the enzyme. So a clinical evaluation of the Performa. So it increased the ability to improve elasticity through elastin. It increased the ability to improve wrinkles through collagen and elastin, and it also improved the ability to reduce photoaging. Okay, and on the pinch test shown here and the charts in the middle, that is maintained for up to 6 months afterwards with a very good immediate return characterized by the little circle number 1. Okay, so the VISIA skin analysis showed improvement in wrinkles around the eye by up to 44%, and in the forehead even up to 71%, and 49% improvement in the photoaging. So this was study which is ongoing. It's done on 50 female patients in the age range 40 to 67, and all of them have had 3.5 mils of Performa performed in 4 sessions, 10 days apart. So in the top left picture, we see that there's an improvement in skin reddening of up to 40%, the dyschromia below it by 49%, and improvement in the wrinkles in the forehead by 71%, and around the eyes by 44%. So what is the composition of Performa? Well, importantly, it comes pre-mixed, which seems to give better results than having to mix it yourself. And this time it's in 3.5 mils. So you get this 35 milligrams of the low molecular weight heparin, but the added amino acids we were talking about. So that actually you are now getting 37 milligrams per mil of the amino acids, which has this hydrophobic effect to reduce the action of the enzyme hyaluronidase. So what can we use it for? Well, we can use it for anything in the skin where you want to improve its performance and appearance, but particularly it works very well in the face, neck, decolletage, and hands. And I find that we've been getting excellent results, particularly around the eyes and particularly around the mouth, areas which are difficult to treat. Typically in my clinic, I would have been using CO2 laser before with its downtime and potential complications. Now I can do these injections, which take a few minutes, and there is little or no downtime. There may be a little swelling, the occasional tiny bruise, but my patients are finding for the excellent results they're getting, they don't mind that at all. It's a relatively quick procedure to do and relatively painless. So the high performance technique. On the first session, which is the activation phase, in the face, neck, and decolletage, in the face and neck, we do 1200 with Performa. So Sunekos 1200 with Performa, because this is the activation phase. The important point of the 1200 at this stage is we mentioned it protects against the scavenging by free radicals. So it helps to protect the fibroblasts in this early stage and allow activation in the process of stimulating collagen and elastin. 14 days later, we do just the Sunekos Performa, the 3.5 mils. And this is the rebuilding phase where the collagen elastin is really starting to kick in. And then 14 days later, we do the third one, and that's almost to set the lasting effect. Now, if there is severe signs of aging, there is an optional fourth one, which we do again at 14 days. The 1200 can be done with cannula or needle, but the Performa, which I will show you in a moment, we do the higher performance technique, and that's with needle only. So this is the 1200 with needle. So look, concentrating on the blue points first, we can see the Langer lines or folding lines across the face. And if you look around the mouth, you would see these lines arching around the mouth. And that is classically where we get the folds and the elastosis that our patients dislike so much. So at those blue points, you can inject 0.3 in the mental region and below the eye, and Above the top lip and in the nasolabial fold area, you have the option of injecting 0.3 to 0.6. Obviously, you would inject 0.6 more severe and you want to get better results. However, you could, at those 2 points, just inject 0.3, which would leave you with an extra 0.6 mils, and then you could inject 0.3 mils at one of the yellow dots, depending on what your patient requires and what they need. So this is done with a 30 gauge needle, 30 millimeters long, and I would recommend a 1 mil syringe because it allows you to be more accurate. We are injecting into the medium or deep dermis, and this can be achieved by injecting at 45 or 30 degrees, but you can even inject more superficially at 20 degrees as long as you put more of the needle in, so you're getting down to that area. How would you know you're in that area? Because you're going to have more resistance and require more pressure to inject the fluid, whereas if you're in the subcutaneous tissues, it will flow very easily. 1200 with the cannula. So the red dots represent the entry point that you would make with your needle, and you can use different type cannulas. I personally would recommend a 25 because you've got more reach with it and can get to the midline above and below the lips more easily, whereas I think you definitely wouldn't be able to do that with a 30 gauge. So we go in at the entry points and then we're fanning in different directions. Now, below the mouth, it's 0.3 mils, and in the mid cheek, it's 0.3 mils. But again, for that area above the mouth, you have the option of 0.3 or 0.6 mils, so that if you wanted to treat other areas, you would just do the 0.3 mils, so it leaves you with another 0.3 to inject somewhere else. We're now moving on to the high performance technique, and this illustration is if you have chose to do the mid and low face. There are different options, and I will cover those a little bit later in the video, but I want to focus on this area for the mid and low face. Now, concentrating on the blue dots first, if we come down from the midline, we see that there are 3, and this is the rule of 3M, 3 injection points in a line there. Typically 1.5 centimeters apart. It's going to be with a 30 gauge needle and a 1 mil syringe against the medium or deep dermis. Okay, then coming down from that, you would see perpendicular always to the folding lines. We'd see another 3 dots and another 3 dots below, and that's the area where we get lots of folding of the skin and the elastosis. You would do another 3 there. Then you would do 1 below the mouth in the mental region, and the one at the very bottom is actually underneath the chin, so 0.1 mils there. And then we have 0.03 mils in little blebs for the static crow's feet or laughter lines, and for the vertical lip lines above the mouth. This is showing the Performa technique and high performance for the full face. The difference being this time that we're doing the forehead, all again 0.1 mils, so that's been added. Again, perpendicular to the folding or Langer lines. This time though, because we're doing the extra in the forehead, we're not doing the laughter lines and the vertical lip lines. The high performance technique for the neck and decolletage. The blue dots again are 0.1 mils, and it's the same procedure, without doing 30 gauge needle with a 1 mil syringe to the medium or deep dermis. Notice this time though that on the first session we are not doing 1200. We are just doing the 3 sessions of Performa with an optional if there is more skin damage. Risk areas for vascular occlusion. To date, there has been no episodes of vascular occlusion with Sunekos, but as practitioners, we need to be very careful and always inject safely. So as long as we're wary that in the upper face you have the supraorbital, supratrochlear artery in those locations, at the medial canthus of the eye and the alar triangle, we have the angular artery, and we're always injecting superficially in the medium to deep dermis, so we're well above these structures. Inject slowly, so should you happen to go deep and be in the wrong area, you reduce again the potential risk of vascular occlusion. So these are some results, and I think this is where it gets quite exciting. Patients are always coming into our clinics saying that the area they don't like is under their eye. And they'll say, particularly when I laugh, I see all these lines. What can we do about it? Can we put Botox in this area? Well, of course, we know as practitioners, Botox doesn't work, or very little effect on this loose skin. Likewise, surgery isn't easy because particularly with the lower lid blepharoplasty, the surgeon is looking to take that extra bulging infraorbital fat pad and actually only a minimal amount of skin. So taking a minimum amount of skin isn't going to treat these ladies. And so we can see the results there. We get an improvement in the dark circles, improvement in the fine lines, and tightening of the skin. The patient looks less tired. So the technique for the periocular area for the eye bags and dark circles, we again do the 0.1 mil injections above the eye. This time, there is an optional 0.05 mils at the tail of the brow. And in the laughter lines or crow's feet, we do the purple injections of 0.03 mils. That's why it's important to use a 1 mil syringe. I find it personally very difficult to gauge 0.03 mils with a 2.5 mil syringe. And you're almost seeing little blebs as you do it. And the yellow ones are optional. If you do the yellow ones, you're doing a total for all of those of 0.8 to 1.1 mils. So that's the total of them, not at each point. Around the eyes, we're doing just 2 treatments of Performa, no Sunekos 1200, with an optional 3rd or even 4th treatment, depending on how deep these lines are. And I would suggest the deeper the lines, the more sessions you're going to need. Excellent results. Straight away, you see less tired on the right, a big increase in the tightening of the skin, much less fine lines, and those dark circles have almost gone. And how often are we asked about dark circles? And we've used things like lasers and various creams, and none of them work that well for dark circles. And I think finally we have an exciting product which can improve these areas. We can also use Sunekos Performa in the hands. The difference being this time that you need 1200 on each occasion. So you would do 2 treatments, 14 days apart, with an optional 3rd, depending on the severity of the aging. I would again use either a needle or a cannula. You could also combine this with other treatments. So you could peel the skin or laser the skin first to improve the appearance of the skin. And we have the Sunekos Tro Peel, which works excellently to give some fine peeling of the skin, which you would do before starting the protocol. And you could even repeat after you finish the protocol, not on the same day though. I personally would leave a gap of 2 weeks. If you finish the protocol on one day, leave 2 weeks before you do your next peel. So now we're showing the actual injection technique for the Sunekos 1200 and the Sunekos Performa. So the Sunekos 1200 is with a cannula, typically a 25 gauge. Make sure your entry point is distal to the carpus, and with your cannula, avoid the area of the tendons. You want to be superficial as you can above them, so you can almost see the outline of your cannula, and you're doing retrograde threads of the product. On the right, we have the Sunekos Performa. And again, make sure your injections start distal to the carpus. And we're doing 0.1 mils with a 30 gauge needle at a distance of 1.5 centimeters, which gives you a total of about 15 to 17 boluses per hand. With the needles, avoid the tendons because it's painful, and avoid the veins because it can cause bruising. A point to make with all of these treatment protocols, that after treatment, you should massage. I personally like because it's nice, soft, and you can gently rub around the areas to spread out the product. And if there's any lumps and bumps, they will disappear within 48 hours anyway. So tell the patient this, but help to smooth out the product and spread the product.